Honorable Senator Abbas. I want to agree that definitely in the distribution of sporting facilities, the northeastern region of this country has not received its due consideration. And that is why, Honorable Speaker, we have made the transformative decision to now develop infrastructure in the context of a master plan, so that we don't do it at individual whim, where a person decides this one will go to this corner. We have done a master plan that provides empirical logic why we would put a facility in Marsabit, why we would put one in Garissa or Mandera. And in the context of that master plan, the long wait by the northeastern region for sporting facilities will definitely come to an end. And I want to assure you that through the Talanta Hela program, for instance, we have seen sporting activities in Wajir, in Mandera, in Garissa, greatly limited by the limitations around facilities. So it is something we have already experienced, and I want to assure Senator Abbas that this will receive due, indeed it is receiving due consideration. With regard to the necessity to engage young people, I do agree with the Honorable Senator that left unengaged or left on their own, there's always the risk of drugs, the risk of radicalization, and many other challenges. And that is why we are being very deliberate, very intentional, very structured in growing talents from the best. The reason behind our revolutionary Talanta Hela initiative, and all the counties of Kenya, including Mandera, Garissa, Wajir, and that whole belt of the northern region is fully incorporated in the Talanta Hela program. Every part of this country has to get the opportunity to be part of development in sports. And of course, we are also happy that the competitive, very transparent, very accountable process gave this country a fine Kenyan young man from that region who we believe is up to the task of delivering in this position. I thank you, Honorable Chair.
Thank you, CS. Senator Fatuma Dulo.
Chair, Mr. Speaker, thank you very much, and CS, welcome to the Senate. First, let me say congratulations to one competitor who was against me in the last race of Senate in the name of Nur Mohammed, that I'm happy the government has given him an opportunity to serve in the fund. Number two, Mr. Speaker, I wanted to ask CS. Of course, Senator Abbas has asked about the counties. 2013, the government of Kenya has promised to build stadia in most of the counties. And if I may speak for Isiolo County, we have a very small stadium that is being constructed by the county government. And I think maybe in future, the county government or national government should be able to work together with county government to come up with a better stadium so that you complement each other and come up with a proper stadium that will serve Kenyans. Finally, Mr. Speaker, if you can allow me, if you don't cut me short, just one more question on the other second part. Mr. Speaker, I just wanted to know how are the projects identified by the sports fund to be financed by the board? Thank you.
CS.
Thank you, Honorable Speaker, and through you, thank you, Senator Fatma. I want to confirm and to admit that the promise of 2013 on sporting facilities was not fulfilled. That is a fact that we cannot run away from. But also to confirm to this Honorable House that we now have a new administration, new leadership, new sheriff in town with a new style of doing things. And our style is called Bottom-Up Economic Transformation Agenda, which is very, very focused on transforming the fortunes of this land, every corner of this land, every blade of grass, every grain of sand, bottom up, meaning that all the corners of this country are guaranteed investment in all sectors, including this sector of sports. and to agree with Senator Fatma that indeed it will be good, and I want to urge the leadership of counties to work with the national government in developing sporting facilities. This ensures standardization. I can confirm to this House that we have been out there to look at some of the stalled facilities that were initiated by the county. Let me give the example of Bomet. We went to look at Bomet Stadium, and the manner in which that project was conceived and deployed by the county can tell you that it could have been done a lot better if it had been done in partnership with the national government in terms of standards. And I can confirm here also that we have taken the initiative to approach a number of counties. For instance, we have agreed formally with the county government of Kakamega on completion of Buhungu Stadium, and we have agreed on a certain way of doing it in a manner that meets CAF and FIFA standards. We have also done the same with the stadium in Olkalau. We are doing the same with now in Bomet. We are making an intervention in Bomet. We are making an intervention in areas where we believe definitely county governments working with national governments will deliver better. And so even in Isiolo, we should be able to do better in terms of what is going on with the stadium in Isiolo. I thank you, Honorable Speaker.
Senator. Yes, she claims there was a second part of the question.
Yes, that is a significant part of the question. The logic, the procedure, the how we identify projects. And I did mention at the beginning of my answer that we came into office and found all these stalled facilities all over the place. Water in Makueni, Kamarin in Elgeyo Marakwet, Marsabit, and all over the place. And one of the things we noted right away was that there was no logic in the selection of some of these projects. And that's where we now have a master plan. The Sports Infrastructure Master Plan provides logic for each of these projects. I'll give an example. There was a plan to do an international stadium in Kamarin in Elgeyo Marakwet County. Upon consultations and empirical logic, we realized no one will ever go to compete in Kamarin because of the high altitude. It is a training place, not a competing place. And so we have decided to do an elite training center, an elite high altitude training center, instead of an international stadium. So we now have a frame that is logically conceived, which we believe will be able to fix this challenge and make sure that every corner of Kenya is reached in a logical manner and not left to the whims of individuals. I submit.
Senator Margaret Kamar.
Thank you, Mr. Speaker, for the opportunity. I want to thank the Minister for re-energizing the sector, and we believe he will be able to do well if he implements what he has presented before us today. As I seek a clarification on one statement he made, I also want to congratulate Kevin Kiptum, the new marathon world record breaker. And the minister already awarded him the 5 million, and we thank him for that, to re-energize the whole sector. This is actually a member from my own village where I was born. But I wanted to get clarification, Mr. Speaker. When you pay a world record breaker the award of 5 million, does he still get the award of the gold? Because you can get gold without being a world record breaker. It was not clear to me whether when you break the record, you are given an additional award so that you are excited, so that our youth can move on to break records, because they know there are two different awards. Is it still the same one? The same golden one of gold, or you are giving over and above that? Otherwise, Kiptum, I say congratulations.
Thank you, Senator. I would want us to take the last two questions, then you can answer all the three questions. The last two questions will be asked by Senator Cherargei and Senator Mohamed Chute. Senator Mohamed Chute.
Thank you very much, Honorable Speaker. I have two questions, but one I will ask now, the other one later on. Mr. Speaker, let me take this opportunity to thank our CS for coming here today, and also thank him immensely for the contributions he has made to this country, both as a politician and also as a CS. Similarly, Mr. Speaker, I would want to thank the CS for a successful bid of AFCON sports games. Mr. Speaker, let me also take this opportunity to join my fellow senators, both Abbas and Senator Dulo from Isiolo, to congratulate His Excellency, our beloved President, Dr. Samuel Ruto, for appointing our able CEO Sports Fund, a young Senate aspirant, and also who has worked for IBC for many years. And Mr. Speaker, you will find this gentleman in the office from 6 a.m. to 11 p.m.
Senator Chute, I was expecting you to ask for a supplementary question.
My question will be very short, Mr. Speaker. This guy comes from Isiolo. On behalf of the people of Marsabit and Isiolo, I want to congratulate him. Thank you very much for the good job you are doing. My question, Mr. Speaker, is about Marsabit Stadium. The CS has elaborately said, and he said it very well. He knows about Marsabit very well. But I wanted to know from the CS, if he has gone to Marsabit, to look at the collapsing structures.
An amendment to the law that we passed here in 2016, I expect to see a legislative proposal here, because that is something that has the potential of embarrassing this country in a very bad way. Lastly, Mr. Speaker, is on management of federations. Many of our federations pose a great challenge to the ministry, and I understand about sports very well. Apart from politics, the only other thing that I engage in so deeply is sports, and I'm a lover of sports. And I know the challenge that we have with our federations, Mr. Speaker. And I'd wish to hear from the CS, what is his plan? What is his plan on how to better manage and at least guide? I know because of international obligations that Kenya has signed on to with many other global bodies, his hands are tied on many other aspects. But at least there are those that we can resolve locally. Athletics, for example, hasn't had elections for over a decade. Yet some of the people that have taken the government to court, I see them sometimes in the company of a CS doing certain responsibilities. So what is his plan in unlocking this challenge that we have with our federations? Thank you for your kind consideration, Chair. Speaker.
Cabinet Secretary, I think there are 4 questions.
Thank you, Honourable Speaker. I will take them in reverse order, starting with the question posed by the Honourable Majority Leader. I want to agree that doping is a matter of, I would actually even call it a matter of national interest, a matter of strategic national interest. And indeed, when this administration came to office, one of the very first crises we had to confront immediately was the very real threat of Kenya being banned by World Athletics because of a doping menace, a doping crisis that had reached unimaginable levels. And I'm glad that among our key success stories was that we engaged with World Athletics, the Athletics Integrity Unit, AIU, the World Anti-Doping Agency, WADA, and we were able to agree on an intervention plan. Indeed, among the very first measures we took in office was to host a multi-agency forum to agree on how to confront this plan. And we agreed on specific intervention measures. One of those measures was to put in place a multi-agency team to lead the anti-doping effort, which we have done. We have put together a team, and that team is actually led by a former elite athlete, Wesley Correa, who leads that team. We also committed significant funds, $5 million a year for the next 5 years, to help propel that. And therefore, we have a team. What we realized was that the previous war against doping was rather disjointed, and effort had not been made to join dots. Now we have a multi-agency team that brings together investigative bodies, NIS, DCI. We have the judiciary that is part of this team, so that we can be able to deal with issues of prosecution. We have the Department of Health, which is part of this team. So it is a composite team which can deal with these menace from prevention, because prevention is key. And by the way, for these athletes, arrest of or rather nabbing an athlete is not very useful to the athlete. What is really useful is prevention. And so the significant investment has to be at that level of prevention, investigation. I visited a camp, I can inform the Honorable Majority Leader through you, Honorable Speaker, that I visited a camp in E10. And one of the things I noted was that it is actually possible for an athlete to run into trouble by merely taking drugs across the counter. You walk to a chemist, you buy a drug across the counter. That drug may contain some elements which will actually ring bells, and you get into trouble with anti-doping bodies. And so I want to assure this House to have faith in the program we have put in place, the team, the multi-agency team we have put in place. It may have taken a bit of time, but remember the magnitude of the crisis we inherited. And it required a well-thought-out plan. Indeed, when the president of World Athletics, Lord Sebastian Coe, visited Kenya in January this year, he sympathized with us, and that is why World Athletics agreed with the plan that we put on the table. I want to assure the Honorable Majority Leader in this House that we'll definitely move with greater haste to roll out the program that we have put together under this plan, led by this multi-agency team. We will also be more available, but I can also tell this House that there are investigations that are at a very advanced level, advanced stage. There are some cases that are at a very advanced stage, of course, for obvious reasons. I wouldn't divulge details. And so I believe that we are on a good course in our anti-doping war. And the mantra in the ministry today is zero tolerance to doping. That's the mantra that we are driving. On the management of federations, yes, if I were to pick challenge number one for this ministry, the number one ranking challenge, it would be federations. And it is across the whole sporting arena. From swimming, we have had a big challenge with swimming. The last 3 months, actually, we have spent so much time to sort out a swimming crisis going back 7 years. We are on the verge of cracking that crisis in swimming. Football has had its challenges. The Honorable Majority Leader is right to say that he and I go a long time, and he and I have shared a lot of thinking, a lot of thoughts around the question of how do we fix our football? How do we align our football? How do we propel and deploy the full potential of our footballing talents? And so we have put together a framework of engagement with federations. I did call all federations to a forum. All of them, 69 of them, turned up. We agreed on a number of irreducible minimums. Those minimums included transparency and accountability in the utilization of resources placed at their disposal. It also includes governance, because the biggest challenge in federation is governance. And I can tell you that when you fix governance, it's amazing to see the results. You can see what is happening in our rugby. We were able to sort out the leadership issues in rugby. Our rugby is actually coming back. And our Shujaa team has just beaten the rest of Africa to qualify for the Olympics next year. And so if we fix the leadership in our federations, we will definitely perform better in sports. I want to give this as my assurance that we are on to this. Football, we have a plan, a roadmap on how we are going to sort out football and the rest of the federations. But let me also admit that among the greatest challenges we face is litigation. Every time you make an effort, someone runs to court, a court issues an injunction. We have faced those injunctions. Athletics Kenya has injunctions running back almost 10 years. We are figuring out how to deal with this litigious environment or a culture, even as we fix our sports. Let me move quickly to the question posed by Senator Cherargei, the travel by our athletes. This is a budgetary issue that cuts across the whole of the sporting arena. And it is something definitely, I can tell this Honorable House, it is something that would not be beyond the ministry to consider a review in the event that there is a sufficient budgetary provision to be able to provide our athletes with better traveling conditions. What we do normally is that we try to ensure that the athletes travel in good time so that they arrive at their destination in good time and they have sufficient time to relax and to rest and to train before competition. But if I'm hearing this House say that we want our sportsmen and women to travel in more comfortable conditions, then that is something which definitely the ministry would listen to and consider within the normal budgetary limits. Quickly moving on to the question by Senator Margaret Kamar and Senator Honorable Speaker, let me confirm that the 5 million reward to a world record breaker covers two terrains. There are competitions which do not involve what you may call classical podium finishes or classical podium finishes of gold and all that. And the example are the city marathons, like the Chicago Marathon. And so you break a world record, we will give you your 5 million. Now, let's take the example of the Olympics, which is a sport that, or is an arena that also takes pride in the podium finish. So you win gold and you also break the world record. Then what? The 5 million is then treated as an enhanced reward. It's treated as an enhanced reward. So it covers both. But should you win multiple medals, and I'll give the example of Faith Kipyegon, who won 2 gold medals in Budapest, then you are rewarded per gold medal. The reward that we have for every gold medal. And for instance, our reward for gold medal at that level is 3 million shillings. So Faith was rewarded with 6 million shillings, 3 million for each of the gold medal. That is how it has been structured. But again, this is a policy, it's a new policy that the ministry has put in place, and it would definitely be subject to input of the Senate. We would be willing to listen to how to make this scheme even better than what it is today. I think I'll now move on to the question by Senator Shule. And Senator, I want to appreciate through you, Honorable Speaker, for the kind words from Senator Shule. And just to tell this Honorable House that indeed, we inherited a total mess in this sporting arena, a total mess. We came to office, we found Kenya suspended by FIFA, we found a crisis with doping, crisis in swimming, crisis in handball. It was crisis. Everywhere you looked, you saw crisis. And I'm glad that 1 year down the line, we can count milestones of success. The other day, I sat back to listen to governors debating where the Africa Cup of Nations should be hosted. And I said, wow, what a good debate. 11 months from a FIFA suspension. I mean, to imagine that 11 months ago, we were not even talking football because the country was suspended. A short 11 months down the line, we are now contesting where AFCON should be held. It is remarkable. It's a remarkable turnaround, and is a remarkable success stories. And it is good for us to commend the successes of our teams. Let us commend the team that put together the bid. I really commend His Excellency the President, who was really the champion of this bid. It was the leadership of the President that rallied his regional colleagues, President Museveni in Uganda, President Samia Suluhu in Dar es Salaam, to come together really and support this East Africa Pamoja bid. And I applaud our President and his colleagues in the region for that. Let us also applaud our teams that have done well as we prepare for the Olympics. Our volleyball women team, Malkia Strikers, have conquered Africa and will be at the Olympics. Our women sevens team, the Shujaa, have conquered Africa and they'll be at the Olympics. Our team in Riga, Latvia, conquered the world and emerged top in the world. Our Budapest team conquered the world and led Africa in Budapest. Our football is back. Harambee Stars is making baby steps to come back. Next Monday, we'll be playing Russia in Turkey. And this will be the first time for a Kenyan national football team to play an A-list team in global football. And perhaps where I would invite this House to really, really commend is our women football. Our women football has really, really grown. I was with Senator at Nyayo Stadium to watch our rising Harambee starlets. Our girls put 6 goals past a very experienced Angolan team to literally qualify for the next round in the race to the World Cup Under-20 Championship. And before that, the senior women team, the Harambee Starlets, did something that no Kenyan team has ever done, to beat a Cameroonian team in a competitive game when they knocked out Cameroon in the qualifiers for the Women Africa Cup of Nations. And we are now preparing this team to face the next round, and we have a lot of faith that they'll qualify for the competition. So overall, our sports is at a good level, and I believe that we are making good progress. I beseech this House, I ask this House to support the efforts we are rolling out under the bottom-up economic transformation agenda in this sector of sports. I submit, Honorable Speaker.
Thank you very much, Cabinet Secretary. At this point, we will give you leave. Thank you very much for answering all the questions, and thank you for the good job you're doing at the Ministry, and we wish you all the best. Thank you, Cabinet Secretary, and your team. Honorable Senators, the question number 11, 12 by Senator Kinyua, and question number 45 by Senator Lomenen have been deferred. Next order.
Order number 8, the Digital Health Bill, National Assembly Bills number 57 of 2023, second reading.
Majority Leader. And Majority Leader, at this juncture, I will use Standing Order number 34-2A to extend the sitting of this session by another 15 minutes so that you can be able to finish moving the motion.
Okay, that's good, Speaker, because gives me sufficient time to move seconding, and maybe even one or two of our colleagues can contribute, because I don't intend to be long on this, Mr. Speaker. I understand the interest from our colleagues. So, Mr. Speaker, sir, I beg to now move that the Digital Health Bill, National Assembly Bill number 57 of 2023, be now read a second time. Mr. Speaker, this is a very important bill or piece of legislation. Colleagues will recall that when we were in Turkana for Senate Mashinani, I did mention that there are 4 enabling bills to the UHC. This House successfully transacted 2 of them, completed them, complete with amendments. We fostered devolution by ensuring that many of those funds are locked up in our counties, and agreements ensuring that county governments and the national government relate and respect each other, Mr. Speaker. This bill now further, Mr. Speaker, is an addition to the other two, the one on primary health and the one on community health promoters, Mr. Speaker. This is about technology and the use of technology, Mr. Speaker, to enhance and make health easily and readily available to our citizens. You do know, Mr. Speaker, for a fact that many of the rural communities that we represent, if your mother, if the caretaker, the caregiver, loses an exercise book, in my village they used to use the 32-page exercise book, and in fact it will be divided into two. If a mother, for whatever reason, loses that particular book, the health records of that particular child disappear. And the next time she goes to clinic, first she has to do first 5 minutes of being given a tongue lashing by the community nurse. Then they begin to build up the records. Mr. Speaker, unfortunately, that story hasn't changed. Even as we become adults, as we speak well here in Nairobi, to many of the people that we represent in this house, the issue of their health records is something that they continue to struggle with. Mr. Speaker, many communities are not able, Mr. Speaker, to keep the health records of the citizens. Yet we know that we are living in the data age. This is the information age, Mr. Speaker. This is a time upon which, Mr. Speaker, when you provide data readily available, then it is a source of wealth, Mr. Speaker. I know that this bill, Mr. Speaker, is extremely crucial and important, and I want to ask colleagues to take time and support this particular bill, Mr. Speaker, because of the length of time that it has taken to prepare it, Mr. Speaker, and the proposals that are therein, ensuring that our citizens are able to have their records kept in one interoperable system, that your records in as far as Turkana, Senator Lomonen, your citizens, if they come to Nairobi and visit a health center that will be on this national health integrated digital health information system, they will be able to access their Turkana records while here in Nairobi. Something that is done in many of the private hospitals, but unfortunately, Mr. Speaker, is not readily available to our citizens. So we are trying to make legislation, Mr. Speaker, to enable the ordinary villagers, the people that we represent in this house, Mr. Speaker, to come onto the civilized 21st century and the practices that are therein. It's not anything new. If you know about, for example, M-TIBA, it's a program that's run by Safaricom and I think a few private entities. They do the same thing, Mr. Speaker. Yet, it is to the exclusion of ordinary citizens, Mr. Speaker. And therefore, this bill has got very good, elaborate propositions on how a comprehensive, integrated digital health information system, Mr. Speaker, can be rolled out and include a complete medical history, past diagnosis, medications that you've been given, the treatment plans, Mr. Speaker. Mr. Speaker, even these issues about litigation that you continue to see about misdiagnosis or patients that have been treated wrongly, Mr. Speaker, this will become things of the past, or at least health authorities will be able to refer back to your file and establish whether you have been handled properly or you are not given the proper medication, what is the history. You know, Mr. Speaker, this is something good. This is what we need for our country. This is what many citizens are yearning and dying for, Mr. Speaker. With this kind of readily available information, Mr. Speaker, imagine even the cost of medical research will be brought down, and there are big pharmas that will be able to make useful the information that is provided herein and guide them even in terms of their research so that they are able to see why is it that people from a particular village in Kericho always face are susceptible to a particular kind of strain of disease, Mr. Speaker, and they can be able to release the proper medication. Here in Kemsa, for example, they shall not, county governments will not just be buying drugs with the hope that, oh, this or that is needed. Information will drive a fit-for-purpose system, Mr. Speaker, that ensures, Mr. Speaker, that the information that is set out or sent to ordinary citizens, Mr. Speaker, is important. And therefore, Mr. Speaker, I want to celebrate and say that Kenya has made tremendous progress in efforts to progress in digital technology. We are the trendsetters in technology, Mr. Speaker. You know that in the space of finances, the rest of Africa, including the globe, they come here to learn of our practices. This is another area, Mr. Speaker, that we want to lead the world into appreciating and knowing. Yet, Mr. Speaker, when comparatively with other countries that are of our standing, Mr. Speaker, I was listening to the BBC yesterday, Mr. Speaker, while driving to work, and I heard on the program, Mr. Speaker, how people have made use of technology and systems such as this to even ensure that all the kids in the country get immunization at the right date and at the right time, Mr. Speaker. And that with the use of technology, they are able even to remind mothers, because ordinary mothers in the village sometimes, Mr. Speaker, are not able, Mr. Speaker, either because they have so many other things that they are dealing with and they don't remember the day of vaccination for the child, or even, Mr. Speaker, that technology makes it possible for community help programs, Mr. Speaker, to be able to send bus fare, you know, either a bus ticket or whatever means, Mr. Speaker, to mothers that have kids who on a particular day are supposed to be taken, mothers that come from disadvantaged backgrounds, Mr. Speaker, and they know that when we analyze a particular lady, she may not be able to take her child for vaccination, and they send them a bus ticket or something like that. Therefore, Mr. Speaker, the point I'm making is that the world has made advances in medical technology, and this is the step that you are trying to make, and I want to urge colleagues to support this particular bill. Has good provisions on how to set up this institution, the qualifications of the CEO, people who will run, all those issues and fears that people have on safety of the data that is captured, all captured in the bill, Mr. Speaker, because even part of the board that will oversee the operations of this body that we are creating to oversee the digital health platform, Mr. Speaker, includes officials, the data commissioner in person or a representative in writing, Mr. Speaker, to ensure that your information is not just abused. And if there will be use of it, Mr. Speaker, it is for the betterment of the people of Kenya, to ensure that you have this information readily available. Therefore, Mr. Speaker, it's pretty much a straightforward bill, which I want to ask colleagues to support, Mr. Speaker, so that we may be able to advance and grow the country into the next level. There are various clauses in the bill, about 60 of them, but many of them cover that particular space about what I've spoken about. With those very many remarks, Mr. Speaker, I beg to move and request the Senator for Kakamega, Dr. Boni Halwale, to second. Thank you, Mr. Speaker.
Thank you, Mr. Speaker. Mr. Speaker, I want to thank the leader of the majority for giving me the honor to second this very game changer of a bill. Mr. Speaker, I couldn't be a better choice. I am one of the few members in this Senate and in the National Assembly who is an expert in the matter which is at the heart of this bill. Drawing in support of this motion, I want to ask colleagues to draw experiences from what the government did to improve the education system, the so-called NEMIS, National Education Management Information System. It has revolutionized the management of national exams and monitoring of children as they move towards national exams. It creates a unique personal identification code which helps the child to be monitors as they move up the ladder. In this case, it's more critical because, Mr. Speaker, this bill will speak to life-saving measures. It might look simple, but listen to this. A woman who has never gone to school, and there are many in this country, she is probably a young mother, pregnant for the first time, She has no idea why the nurse, when she went to attend an antenatal clinic, why the nurse gave her an injection. For all she cares, probably it was because she was having a cough or she was having malaria, name it. But the injection she really needed, Mr. Speaker, was one to secure the unborn child, against tetanus at birth. It is called the injection against tetanus. It's called the TT vaccine. Mr. Speaker, when this girl goes to the clinic, she got an injection of malaria. She's asked, have you ever been to the clinic? She says, yes. Have you received an injection? Did you receive an injection? She says, yes. So the subsequent nurse assumes that the injection she got at that time was against tetanus, when actually it was for treatment of malaria and not against it. So this girl carries this baby for 9 beautiful months. Child is delivered under difficult conditions, and child dies from tetanus. Now with this bill, all that the nurse will need is to key in the details of this mother, and she'll realize that the mother at that time did not get TT. It's a life-saving. Mr. Speaker, it also speaks to the life-threatening conditions of allergies. If at the first incidence a patient is exposed, usually children, to drugs that cause allergic reactions, for example, sulfur, drugs to which the child is allergic, and they have reactions, those reactions will be recorded, and this child will be prohibited from being exposed to sulfur-containing medications. Now, when that record is on computer, it means that every time this child appears before another medical person, you key in and you know that this child should not be given this kind of injection, and you save lives. Because exposing that child sometimes can be fatal. Another advantage of this bill, Mr. Speaker, is to save on wasteful expenditure. We have consultations where specialists, which are very hard to get, specialists in this country doctors in this country are hard to come by. Specialists are even harder to come by. So if a child has had an opportunity to be carried from Lohaha village in Sirisia, from Boyomboli village in Ekolomani, to go to teaching and referral hospital in Moi, and they access a specialist, the opinion of that specialist must remain on paper. So that should the child present before a junior medical practitioner, then they already are guided by a previous opinion by that specialist. Mr. Speaker, finally, we have got illnesses that run through families. We call them hereditary diseases. Mr. Speaker, things like this include sickle cell anemia and so forth. Once an opinion has been made, it will remain on the computer, and it will give the child, the patient, on subsequent visits, an opportunity to get better management. With those few remarks, this is a technical bill. I want to urge all colleagues to trust me, to trust the letter and spirit of the bill, and we all should rally behind the bill and pass it and amend it. With those many remarks, Mr. Speaker, I second the bill as moved by the leader of the majority. Thank you.
Thank you, Senator. Honorable Senators, I propose the question that the Digital Health Bill, National Assembly Bills number 57 of 2023, be now read a second time. I think senators can make contribution. Senator Lomenen, what is your point of order?
Mr. Speaker, given the importance of this bill, I seek guidance from you so that we limit the contribution time of the members. May 5 minutes will be okay, Mr. Speaker.
Majority Leader?
Please. Mr. Speaker, I know there will be intense interest by members to contribute. So like we did in the other bills, Mr. Speaker, if we can keep it at 5 so that as many people get a chance to speak. I myself moved it in 5 minutes, to seconded in 5. So I believe that will be a good time. Thank you.
Thank you. Thank you, Majority Leader. I put the question that the debate is limited to 5 minutes. I propose the question that the debate is limited to 5 minutes. I put the question that the debate is limited to 5 minutes. As many as of that opinion say aye. As many of the contrary opinion say nay. The ayes have it. Senator Mandango.
Honorable Speaker, first, thank you very much for giving me the opportunity to contribute on this digital health bill. Honorable Speaker, first and foremost, I want to thank the Committee of Health, my members, and the stakeholders who we engaged extensively on this bill, Honorable Speaker, for actually adopting and passing this bill. Honorable Speaker, this nation is preparing to roll out UHC. UHC has been a program that has been in the desk of this country for the last almost 20 years, Honorable Speaker, but we've not succeeded as a nation. I attribute past failure to lack of consultation, engaging stakeholders, and bringing on board all the stakeholders, and also bringing in enabling legislation that will then enable the government to roll out UHC, Honorable Speaker. Honorable Speaker, the Digital Health Bill is a very important bill for the rollout of universal health care. Knowing very well that as a nation, that we don't have sufficient senior staff in terms of consultants at the highest level of medical level, Honorable Speaker, there is need to share these very limited resources. This Digital Health Bill, therefore, will provide a framework of sharing medical information between patients, consultants, and doctors from all facilities all over the country. And Honorable Speaker, it is not just the Digital Health Bill that we are going to pass and the creation of the Digital Health Agency that will be established. There are other programs the national government, Kenya Kwanza administration are rolling out to facilitate this process, Honorable Speaker. Honorable Speaker, as you are aware, through the Ministry of ICT, the national government is rolling out the national fiber superhighway across the nation. These 100,000 kilometers. This, again, Honorable Speaker, is going to facilitate the creation, the establishment of systems that can be used for diagnosis at health facilities and instructions to consultants who will probably be seated anywhere in this country. And we all know very well that the majority of the consultants are sitting in most of the urban areas of this nation, like in Nairobi, in Eldoret, in Nakuru, in Kisumu. But we have counties, Honorable Speaker, that have very few consultants by virtue of the areas they're operating from. And there is need for those citizens in those counties to access this specialized service. This is how health is going to be revolutionized, using very little resources you have in terms of human resource and enabling all Kenyans to be able to access that. Honorable Speaker, the Digital Health Bill, concerns that have been raised on issues of protection of data. I would want to say this, that Honorable Speaker, this bill provides for access. But for the first time, Honorable Speaker, the access will have to be applied and authorized, and it will be under the custody of the data protection, Honorable Speaker. And therefore, the worry of Kenyans of health data being accessed will be addressed by that, Honorable Speaker. Honorable Speaker, also as a Senate, being protectors of devolution and promoters of devolution, Honorable Speaker, the Digital Health Agency as a provision for a member to be appointed from the Council of Governors to take care of the interests of counties in that board and ensure that there is seamless integration of services from both county government and national level. Honorable Speaker, knowing very well that referral hospitals are a function of national government and the other hospitals are functions of counties, but because of this digital provision, there is going to be a seamless interaction between the facilities at the county level and at the national level. And Honorable Speaker, probably this is what is going to also provide that very efficient referral platform for patients. And you now don't need to refer patients using an ambulance, transporting a critical patient all the way from West Pokot to Kenyatta National Hospital or MTRH. But you can quickly do a referral on the digital platform and get the results, and the patient can be attended at that sub-county facility in any part of this country. These are the benefits that is going to accrue to this nation once we adopt this bill, Honorable Speaker. Honorable Speaker, I know my time is up, but let me ask and urge all my colleagues that let's support and pass this bill so that we can roll out UAC, and for the first time, any citizen of Kenya can actually get consultant services on a digital platform across the nation. Honorable Speaker, I submit.
Thank you, Senator. Senator Mohamed Chute.
Thank you very much, Honorable Speaker. Let me take this opportunity to stand here before you today to support this bill. Mr. Speaker, as you know, Marsabit County, vast and arid county. Mr. Speaker, this digital health bill is very important for Kenya, but for our county, not only Marsabit County. Marsabit County, Upper Eastern County, Northeastern counties, Turkana County, Samburu County, because of our nomadic structure, nomadic way of living, we are disadvantaged against the normal card-based health care. Mr. Speaker, our people are traveling all the way to a place called Yaballo in Ethiopia and several cities in Ethiopia for medical care. Mr. Speaker, it has become very expensive for the families of specifically Marsabit County in terms of medical bills. Mr. Speaker, this bill, number 57, will make the people of Marsabit be having treatment in the nearest hospital available, Mr. Speaker. Mr. Speaker, this bill is good for data protection. Mr. Speaker, our people are mostly illiterate. They will come today to you with some documents, papers, which are torn out, very old. And even for the healthcare people, the doctors, to even read those documents gets very difficult. But if you have a data that subscribes to a particular patient, it will be kept in that data and it will be accessed from anywhere.
Senator Chute.
Thank you, Mr. Speaker.
You will have a remainder of 3 minutes when this debate resumes, Senator Mohamed Chute. Honorable Senators, it is now 1:15 p.m. and having directed a later interruption of business for the convenience of the Senate, pursuant to Standing Order 34-2A, the Senate stands adjourned until today, Wednesday, 11th October 2023 at 2:30 p.m.
Naam, mtazamaji, kimekuwa kikao cha asubuhi cha bunge la Seneti na sasa tumefikia tamati. Tumekuwa na spika wa muda Seneta Wakili Sigei, na hapo mwanzoni mwa kikao Seneta Okenyuri alipewa nafasi ya kuwasilisha nyaraka mbili kutoka kwa kamati ya afya. Alifanya hivyo kwa niaba ya mwenyekiti wa kamati hiyo Seneta Mandago. Baada ya hapo, waziri wa masuala ya ndani mwa nchi na mipango ya kitaifa Profesa Kindiki alifika tayari kukabiliana na maswali kutoka kwa maseneta. Profesa Kindiki alijibu maswali kadha wa kadha kutoka kwa Seneta Chute. Baadhi ya mambo ambayo aliangazia ni pamoja na nafasi za kazi kwa machifu pamoja na manaibu wa chifu katika kaunti zote humu nchini. Hali ya usalama pia ni swala ambalo aliangazia. Tunazungumzia usalama katika kaunti ya Turukana na pia kaunti zingine zilizoko kaskazini mwa nchi. Akatamatisha pia kwa kuzungumzia kuajiriwa na kusambazwa kwa polisi wa akiba, yani police reservice. Na kulikuwa na maswali mengine ambayo alijibu kutoka kwa Seneta Khalwale, Seneta Methu, Seneta Mundiki, Seneta Muma, Seneta Kisang na maseneta wengineo. Waziri Kindiki alipoondoka, waziri wa masuala ya vijana na michezo aliingia. Anakwenda kwa jina Ababu Namwamba. Naye waziri Namwamba alikabiliana na maswali kutoka kwa Seneta Chute na vile vile Seneta Cherargei. Na katika kujibu maswali, waziri Ababu aliangazia mbio za dunia ambazo zilifanyika Budapest mnamo mwezi wa 8 mwaka huu na njia ambazo Kenya ilitumia kuchagua wanariadha ambao waliwakilisha Kenya katika kipute hicho. Waziri pia aliangazia masuala ya ujenzi wa viwanja mbalimbali vya michezo ikiwemo ule uwanja wa Marsabit na swala la matumizi ya dawa za kuongeza nguvu kwa wanariadha, yani doping, pia ni swala ambalo waziri alizungumzia. Hatimaye waziri Ababu Namwamba alizungumzia kandanda nchini na alipata kuguzia japo kwa kiduchu tu masuala ya AFCON pamoja bid 2027. Na alipoondoka waziri Ababu, spika wa muda Seneta Abdul Haji alichukua usukani kisha akamkaribisha Seneta Cheruyot. Seneta Cheruyot alikwenda moja kwa moja kwa mswada nambari 57 ambao unahusu mambo ya afya kidijitali, yani the Digital Health Bill. Aliyepata kumuunga mkono si mwingine ila seneta wa Kakamega, Seneta Khalwale. Na mtazamaji, kisha mambo yakakomea hapo. Na ili kujua yote aliyojiri katika kikao cha asubuhi cha bunge la Seneti, na kuomba uingie katika tovuti ya bunge www.parliament.go.ke, na hapo ndipo utapata kikao cha Seneti kwa YouTube na pia utapata nakala yako ya Hansard. Mnamo saa 8:30 alasiri kutakuwa na kikao kingine cha bunge la Seneti na kuomba usikose. Nimekuwa wako Vusaka Litu, kwa heri.